So what is HIPAA, right? If you are already a medical interpreter, you already know all about HIPAA and you have been certified before actually being able to work in healthcare. But to those of you that are aspiring interpreters and don't know what HIPAA is, well, you've came to the right place. Stick around because I'm gonna give you a brief introduction into what is HIPAA.
Tune in as Interpret Your World's co-founder, Juan Prieto, talks about the highlights of his workday as a professional medical video remote interpreter. If you are aspiring to learn something new and gain insight into what the world of medical interpretation is really like, then you've come to the right place. Follow along as Juan talks not only about his success, but the daily challenges he has to overcome to become a better interpreter each and every day. This is Unwind Sessions with Juan Prieto.
Oh, hello. Today is Friday, October 8th, 2021. And good morning, Alejandro. Today is a new day and a new opportunity to renew ourselves or just continue living as we are. Whatever stage you are in life, today is the day to actually either continue the right path or it's the time to split up on that fork. Hopefully you make the right choice, and if not, just dust your shoulders off, get up, and start again, right? Let's keep going. All right, today I took a wait, hold on, I gotta give you my commercials. Remember that we are posting vocabulary practice videos on TikTok, on Kawaii, Facebook, YouTube Shorts, Instagram Reels, which we post to Facebook. So that's 5 platforms for you to be practicing your vocabulary, medical vocabulary with us every day. So there's no excuse to not practice with us, with the Interpret Your World team. And you guys are part of our family already. So come on, nothing like family to help you improve your skills and your knowledge, right? So let's do it. Remember that I started yesterday giving definitions on Kawaii. That has not caught up just yet to all of the other platforms because we are low on manpower, but hopefully everything that will be cleared this weekend. Hopefully we can get on that. It seemed to, a lot of the viewers seem to like it. So we're definitely gonna be doing that in every platform. Hopefully we can get started on Monday on every platform, but for now, it'll just be Kawaii or whatever platform I am working with. All right, so we hope to see you there so we can practice some vocabulary, translations and definitions, English and Spanish, both, so you get twice the practice, I guess. All right, and remember that we are also accepting comments on MIP 21, and when MIP 21 reaches 100 likes, we're gonna pick 2 of those comments at random. We're gonna send the people who made those comments exclusive links to MIP 22. We're gonna give them a chance to record their interpretation and send them over to us. That way we can provide them with some lovely feedback, which is very difficult to get in this profession. I have only had like real feedback from another interpreter, quality agent listening to me. It has probably been like 2 or 3 times in my whole 4 years of interpreting. So it's tough, and one wishes you got more feedback, right? But for some reason it just doesn't happen. So we want to be that person. We want to be that agency, that company, that channel, your family that will provide you feedback. We're trying to work on that. This is going to be like our first dipping our toe in the water to see how we're gonna go about that. But once it gets started, hopefully it's successful. Hopefully you all like it and we're able to provide some good feedback for everyone, right? Since I don't know why it's so difficult. We'll probably make our own grading scale, right? The Interpret Your World rating. How do you rank as a global interpreter, right, with a language pair in the Interpret Your World rating. Yeah, that would be nice. I just thought about that right now. All right, so hopefully that'll happen. Help us do it. Post your comment on there for a chance to win that feedback. Right now is at 60 likes. We have 40 more likes to go, so plenty of time, I would say. But don't sleep on your laurels, right? I mean, do it now because you never know. We might get 40 likes in one day. All right, we have just 2 more pieces of information that I have to give you. Remember that we have a Patreon page where with as little as $1 of your support, you help motivate us to create much more content, and we give you access to everything on that page. Medical practice videos, ad-free scripts, answer sheets, vocabulary lists, and much more content. And most importantly, you will forever win a place inside of our heart. All right. And last thing, do you have 2 years of experience in medical interpretation, live in the United States, Mexico, or Costa Rica, and are looking for employment either in VRI or OPI? Go ahead and send us an email. interpretyourworld@gmail.com. By the way, this is a third-party company. This is the company that I work for, that I am employed in. It's a very good company, the best company that I worked for in Mexico. So I don't know how good it is in other parts of the world. I would imagine it's the same. But if you're in Mexico, I would say hands down, you better work for this company. All right. What else? All right, so now let's get started. Today I took a total of 25 sessions, one of which was an audio session. Today was a pretty easy day, except for one highlight that I have today. And what was my highlight? It was a gentleman that would tell like really long stories, and he would pause. Like all of a sudden he would be talking and then he would pause, and then I thought it was a whole idea, and as soon as I started interpreting, he would start saying something, and then I would stop, right, and then I would write, and then he stopped, and then I would say something, and then he just cut me off to be able to say what he forgot. And this went on for a while, and then I don't know where this gentleman was from. He was talking like 100 miles per hour, and he used vocabulary that I was not familiar with, so I don't know what region, what country this person was from. So I mean, on one side, he cut me off, so that really made me angry because he did it many times. And next, the vocabulary, which it was difficult to understand. He's speaking very fast and he's really long segments, so it was horrible LEP to work with. And of course, just imagine that you're in there, and then all of a sudden there's a word that you don't know. Of course, you circle it and you keep on taking notes, but there's like 5-6 words you don't know. That becomes a real problem, right? So I went ahead, and then I had to ask the gentleman. I had to ask him what those words mean, right? I can't interpret what I don't know. And then the gentleman kind of got angry. Like he I don't know what was going on. Maybe he got angry because I didn't understand them, right? I didn't understand his vocabulary, but I mean, we're from different regions, so he shouldn't expect me to know. And I mean, he could have just told me what it was, right? But anyways, he didn't. And after struggling with 2 of his podcasts, the gentleman told the doctor that he was going to be speaking directly to the doctor because he thought that I was not doing a very good job. All right, fair enough. I wasn't doing a very good job because I couldn't understand them, right? And everything that went in with that gentleman's utterances, right? So I was thinking in my head, all right, buddy, I can't even understand your Spanish. That's your first language. What makes you think that the doctor's going to understand your English? And I mean, I was just ready to see how big of a fool he was going to make. But boy, was I wrong. Honestly, his English was not perfect, but his English was much better than his Spanish, or at least I could understand it much better because, of course, he spoke American English. I spoke American English. He spoke Spanish from another country, which I don't even know what country that was. And his English, I understood it perfectly, and everything he said, some of the things that he said in English, I kind of, like I said, oh, maybe that's what he meant. And so he did a very, very good job in English. I was very surprised, and of course I had to eat my words. Of course I didn't tell him to them, but I felt bad because I was already judging this gentleman because I couldn't understand his Spanish. But damn, he like completely, he left me looking like a fool. It's a good thing that it was only me, right? Because if I would have made the statement to the doctor, I don't know, I wouldn't have even wanted to be in that call. I would have probably disconnected. Goodbye, doctor. I'm sorry. I'm not feeling well. Whatever, let me transfer you to another interpreter, right? So this gentleman was just expressing himself in English, and it was very good. I could understand everything. And he still expressed himself in like podcasts. So he was talking so much, and he interrupted the doctor. He didn't let him talk. So I was thinking to myself like, oh, thank you. Yeah, I just dodged that bullet. I don't have to interpret all his lengthy statements. I don't have to interpret his. I don't have to ask him to clarify for vocabulary that I don't know. I don't have to speed, and then I don't have to listen to his words 100 miles per hour trying to keep up. So I was very relieved. I was like, ooh, dodged that bullet. But they kept me on the session just in case there was something they couldn't understand. So I was happy. I was happy that happened. Honestly, I don't know if it's Friday. I don't know what's going on. But that session, I didn't even want to be in that session. Not even after he was talking to the doctor. I don't know. I don't know. I didn't like that LEP, honestly. I know it's bad, and I don't know. He didn't like me either. I'm pretty sure. So we're even. But he did a good job, and I'm glad it went that way. So that's it for my highlight. Maybe not my best highlight, right? But it was a tough session up until the point that he started just doing everything on his own. Then everything was just smooth sailing from there. So everything today was good. Everything today was nice. And let's get started with what is HIPAA, right? The reason why you're here. All right. So to begin, let me just set up my little mouse here. That way I don't have to look away from the camera, right? So HIPAA stands for Health Insurance Portability and Accountability Act of 1996. And the abbreviation is HIPAA, H-I-P-A-A, or acronym, I should say. So this is a federal law that was created to protect personal health information from being shared without the prior consent or knowledge of the patient or of the person who that information belongs to, all right? So that is the reason why this act was created in 1996, all right? And it has several parts. Today we're gonna talk about the HIPAA privacy rule. We're gonna be talking about the covered entities, about permitted uses and disclosures, and about HIPAA security rule. All right, this is just a brief explanation of what it is. I do hope to make some videos in the future where I go into more in depth. That way you can just probably watch one of my videos and get certified. Oh, by the way, you need to be HIPAA certified before you can work in a medical healthcare setting. Why? Well, because of what I'm about to explain right now. Yeah. All right, so the HIPAA privacy rule. The privacy rule mentions the standards of use and disclosure of a patient's protected health information by the parties that are subject to the privacy rule. These individuals and organizations are called covered entities. The privacy rule is important so that patients' identities and information can remain confidential to everyone except for the parties that require the information and are involved in the patient's care. All right, so the privacy rule is a rule that states what can be done, right? It says what personal health information, PHI, remember that, that's important for the HIPAA certification. So it states the type of PHI that can be used, how it can be disclosed, how it can be distributed between parties, right? Because if we think about it, personal health information is information that is very important to a patient. Is information that has information about diseases, conditions, medications they're taking, right? So imagine like someone that is looking, for example, maybe this gentleman is looking for wheelchairs, right? This person can just go up to a doctor and be like, hey, give me a list of all your paraplegic patients or all the patients that need wheelchairs. I'm gonna start a new company and I need a list of patients with wheelchairs so I can sell them to them, and I'll give you some money for that list. And then the doctor's like, yeah, all right, here's my list, give him my money. And then gets the money, and then the person, well, he starts just cold calling everyone, right, bothering them, and this is something that has happened, and it did happen. There's a lot of stories when you're doing the certification. You're gonna see stories like that, and this law was created to prevent that, right? You are not going to be able to share information, and if you pay to receive information, then you're going to get into a lot of trouble, and if you receive the money, you're going to get in even more trouble. So so HIPAA was created to prevent this kind of things that were happening, to prevent fraud, to prevent the really hyped up expenses from insurances, Medicare, and all of that stuff, all right? So now that we know why it was created and what is the privacy rule, what are the covered entities, all right? So these are individuals and organizations that are bound by the privacy rule. All of these organizations and individuals have to follow these rules to ensure that the patient's PHI is protected. So healthcare providers, every healthcare provider, regardless of size of practice, who electronically transmit health information in connection with certain transactions. These transactions include claims, benefits, eligibility inquiries, referrals, authorization requests, and other transactions for which HHS has been established standards under the HIPAA transaction rule. All right, the transaction rule is not going to be described here. And I don't think I had ever heard the transactions rule, because that's not part of certification. That's more for the healthcare providers, right? Because they handle that information. Us as interpreters, we're not healthcare providers, so we don't really deal with the transactions rule, all right? But just know that any healthcare provider that stores electronic information of a patient, or that does transactions, for example, what it says, referrals, eligibility stuff, all of those things, they need to follow HIPAA, what's it called? HIPAA rules, right? The privacy rule, or the transactions rule, and the privacy rule, of course. All right. Another covered entity is health plans. Entities that provide or pay for the cost of medical care. Healthcare plans include health, dental, vision, and prescription drug insurers. Health maintenance organization, HMO, Medicare, Medicaid, Medicare plus choice, and Medicare supplement insurance, and long-term insurers, excluding nursing home fixed indemnity policies. Health plans also include employer-sponsored group health plans, government and church-sponsored health plans, and multi-employer health plans. Exception: a group health plan with fewer than 50 participants that is administered solely by the employer that establishes and maintains the plan is not a covered entity. All right, so health plans, everything, insurance, Medicare, government, private, all of that stuff, everyone that helps to pay for a cost of medical care is considered a health plan, with the exception of what we know, our company, right, that administers a health plan, but it's just like within their group, right? If it's a company, an employer that administers the health plan, then they could sell your private information. I'm sure they don't. They probably have like something stating that they can't do that, right? But I mean, HIPAA just doesn't apply to them. So any health plan has to be anyone that's dealing with health, that works in health plans, has to get HIPAA certified and is bound by the privacy rule. All right, healthcare clearinghouses, entities that process non-started information they receive from another entity into a standard, i.e. standard formal or data content, or vice versa. In most instances, healthcare clearinghouses will receive individually identifiable health information only when they are providing this processing service to a health plan or healthcare provider as a business associate. All right, so healthcare clearinghouses, these are like databases that maybe they are not like the hospital or the healthcare providers or the health plans, but they are like, for example, the what do they call it? The back office? I don't remember. But the administration, right? The financial administration office in a hospital, right? They're like our healthcare clearinghouses. They are not a medical provider. They are not a what's it called? A insurance plan or something like that, right? They are just an administrative team that get the information that the doctors send them, then they process it and they send it over to the insurance, right? But they have that information there, so they have to protect it the same way all of us, the same way that all of us covered entities have to protect it, right? And business associate, this is what we are. This is what the interpretation companies that we work for, this is what they are. We are business associates, and as business associates we need to be HIPAA certified, so that way we can ensure that the patient's information is protected and that we know how to protect it and that we can ensure the protection of that PHI. All right, so business associates, a person or organization other than a member of a covered entity's workforce, using or disclosing individually identifiable health information to perform or provide functions, activities, or services for a covered entity. These functions, activities, or services include claims processing, data analysis, utilization, review, and billing. All right, so business associates, they could be, for example, a collections agency, right? That doesn't work for the hospital. If a collections agency works for the hospital, then of course they are another part. They would be like a healthcare clearinghouse, right? If they're third-party companies, so we're third-party companies, right? And even if I don't know if we work directly with the hospital, I think we are still other than a member of a covered entity's workforce. All right, so I don't know, maybe an interpreter that works directly for the hospital could be a healthcare provider. I don't know. I don't think so. I don't know how that gets, honestly, I don't know how that gets categorized, but business associates, that would be us, that would be any third party company that gets that information. So as interpreters, we have to make sure that we abide by the privacy rule and everything else that is HIPAA related. And of course, we have to be certified to know what this entails and what our responsibilities are. Following on, permitted uses and disclosures. A covered entity is permitted but not required to use and disclose protected health information without an individual's authorization for the following purposes or situations. Disclosure to the individual if the information is required to access or accounting of disclosures. For access or accounting of disclosure, the entity must disclose to the individual. For access or accounting of disclosures. All right, treatment, payment, and healthcare operations. So, disclosure to the individual. If the information is okay, so if they are going to provide information for accounting or anything like that, then they have to let the individual know. Treatment, payment, and healthcare operations, right? Is permitted but not required to use, disclose. Okay, so these are reasons why they can disclose it. They don't need to tell the patient, right? Treatment, payment, and healthcare operations. Opportunity to agree or object to the disclosure of PHI. Informal permission may be obtained by asking the individual outright or by circumstances that clearly give the individual opportunity to agree, acquiesce, or object. Incident to otherwise permitted use and to incident to an otherwise permitted use and disclosure. Public interest and benefit activities. The privacy rule permits use and disclosure of protected health information without an individual's authorization or permission for 12 national priority purpose external icon when required by law, public health activities, victim of abuse or neglect or domestic violence, health oversight activities, judicial and administrative proceedings, law enforcement functions such as identification concerning deceased persons, cadaveric, organized, or tissue donation, research under certain conditions to prevent or lessen a serious threat to health or safety, essential government functions, workers' compensation, limited data set for research, public health, or healthcare operations, right? So what does a limited data set mean? It means that they can disclose part of it, but not their information. For example, one thing that they can disclose is, for example, a patient's disease and treatment, right? But maybe not their age or their name or anything like that, right? It just remains confidential and it's just for research purposes or public health or any other stuff, to get statistics, right? For example, how many patients between the age of 25 to 30 have diabetes that come to this hospital and get treated here, and of course, like if they say how many patients are 25, then they would have to ask the patient, I don't know if age goes into that group. Of course, I am only HIPAA certified because I'm an interpreter. I don't know exactly how to use all of that stuff because I have no knowledge upon it. But I know a little bit. I know a little bit from the certification that I've had. So certain things, and you can share everything as long as you don't share personal information, like anything that can identify a patient, which I've already stated yesterday. So all of the lists that I read, those are exceptions, and those exceptions, everything can be shared without the need to inform the patient. Okay? And for the last section of this video, the HIPAA Security Rule. While the HIPAA Privacy Rule safeguards protected health information, PHI, the Security Rule protects a subset of information covered by the Privacy Rule. This subset is all individually identifiable health information a covered entity creates, receives, maintains, or transmits in electronic form. This information is called Electronically Protected Health Information, EPHI. The security rule does not apply to PHI transmitted orally or in writing. To provide with the HIPAA security rule, our covered entities must do the following: ensure the confidentiality, integrity, and availability of all electronic protected health information. Detect and safeguard against anticipated threats to the security of the information. Protect against anticipated impermissible uses or disclosures. Certify compliance by their workforce. Covered entities should rely on professional ethics and best judgment when considering requests for this permissive and disclosures. The HHS Office for Civil Rights enforces HIPAA rules, and all complaints should be reported to that office. HIPAA violations may result in civil, monetary, or criminal penalties. Yes, you violate HIPAA, you have to accept the punishment. So now that I read, we have to get HIPAA certified every year, by the way, if you're an interpreter. So I think I was confusing a little bit of the privacy rule, because the privacy rule is just everything. It's just everything to keep everything private. And the security rule is just for the PHI, to make sure that the PHI is protected, right? For example, for example, I don't know if I can disclose that. Let me think of another example. All right, so for example, our notes, right? Our notes contain a lot of PHI, right? Date of births, names, conditions, medications. I mean, we technically have all of the information to be able to think up of an idea, and we have all of the information there. And if we wanted, we could just get all of the information from all of the patients that have a certain condition, right? And then just keep tabs, and then all of a sudden from that information you can just call up and be like, hey, I heard you need a new kidney. I got some transplants in the black market or whatever, you know? Or you're trying to sell them some flip-flops. Hey, I heard you have flat feet. I got some flip-flops that'll fix you right up, you know, or whatever. So I mean, we as interpreters, we get credit card numbers, all kinds of stuff. So all of that stuff is high because we do it in something physical, right? It's not electronically. So all of that stuff, we have to make sure that at the end of the day, we just tear up all of those notes and no one can be able to use them ever again. And that is our responsibility, right? One of our responsibilities. Also, we need to make sure that there is no one listening to our conversations, right? Why? Well, I'm sorry to say that if you don't know why, then you're not gonna know why. Nah, just kidding. I mean, we probably already know why, right? Because if we're talking and somebody else is hearing what we're saying, and then we say birthday, name, credit card, the 3 numbers on the back, expiration date, I mean, it's obvious, right? If somebody hears that information, I mean, they could just take that card and make some purchases, right? So that is like the main concern that I can think of. But I mean, if you put your noodle to it, I'm pretty sure you can come up with lots of reasons why we need to protect the patient's health information, right? So it's nice, it's really awesome that the American government decided to create something like the HIPAA. That way they would protect their patients. And another thing that I really like about HIPAA is that because of HIPAA, you as a patient are you decide if you share your information with your employer or not. If you're dying with cancer, you don't necessarily need to share that with your employer, and the law protects you because it's your personal information, right? If you don't want to share with your spouse or with anyone, it protects you. So I find this law very awesome. Well, this act, right? I really like it because it shows that the government cares for its people, right? Of course, there was some massive trouble that was going on, and people were getting very rich, and some people were getting scammed. Some people were just not doing stuff the way that they should, so they had to implement this. And I say, good job. Things still slip to the cracks and stuff, but at least they're doing something to stop it, right? And there is more stuff to talk about. This is just like very superficial stuff, so expect another, I don't know, 2-3 videos so we can cover in depth. But hopefully you already have at least an introductory idea of what HIPAA is, right? All right, so that's gonna be it for me today. Please leave your questions in the comments and I will answer some of them on the next session. Remember that if anything is time sensitive, let me know. That way I can get to the queue. That way I can get to your video before the queue. Remember that I'll be here every Monday through Friday after work. Rain, sleet, hail, snow. You can expect your lesson from this man. All right, I'll be here. I already said that. And a big old shout out, a lot of love to all of our Patreons, a lot of love to everyone that has bought us a coffee, all of our subscribers, all of our viewers, and a lot of love to you that is watching the end of this video. So thank you so much. Please like and subscribe if you like the video and have not done so for much more content. And don't forget to share. Have a very good rest of your day and happy interpreting. Goodbye.
Thanks for listening to this episode of Unwind Sessions. Make sure to subscribe on Apple Podcasts, Spotify, or wherever you listen to your favorite shows. And if you learned something new today, it'd be great if you left us a review. You can also visit us on patreon.com/interpretyourworld or visit our website, interpretyourworld.com. Unwind Sessions.
If you like this video, don't forget to smash that like button. Also, share this video with other beginner interpreters or anyone who can benefit from this information. And as always, I will be posting all the links to these pages down below in the description box. Thanks for watching!